Viral gastroenteritis, often referred to as the stomach flu, is an inflammation of your stomach and intestines. This inflammation is usually caused by a viral infection. Despite its nickname, it is not related to the influenza virus, which affects the respiratory system. Instead, viral gastroenteritis is caused by various viruses that attack and inflame the stomach and intestines, leading to many unpleasant symptoms, which we will explain in a minute. The most common viruses responsible for gastroenteritis are Norovirus, Rotavirus, adenovirus, and astrovirus. These viruses target the lining of the stomach and intestines, causing inflammation and disrupting their normal function. Viral gastroenteritis is remarkably common, affecting people of all ages, though certain populations are more vulnerable. In the United States alone, it's estimated that there are around 21 million cases each year. Children, particularly those under the age of 5, are especially prone to developing viral gastroenteritis, with rotavirus being a major cause. Causes of stomach flu. The way these viruses spread is quite straightforward, yet highly effective. They are primarily transmitted through the fecal-oral route, meaning they can be passed from an infected person's stool to another person's mouth, either directly or indirectly. This can happen when someone fails to wash their hands properly after using the bathroom, or if food or water becomes contaminated with the virus. Viral gastroenteritis can also spread through contact with contaminated surfaces, such as doorknobs, countertops, or shared utensils. The viruses can survive on these surfaces for days, just waiting to be picked up by an unsuspecting victim. And in some cases, the viruses can become airborne, spreading through the coughs and sneezes of an infected individual. Norovirus is the leading cause of viral gastroenteritis in adults and is responsible for the majority of gastroenteritis outbreaks worldwide. It spreads rapidly, particularly in close-quarter settings like cruise ships, schools, and nursing homes. Norovirus can be transmitted through contaminated food or water, by touching contaminated surfaces, or by direct contact with an infected person. The virus is highly resilient and can survive on surfaces for days, making it particularly challenging to control in outbreak situations. Rotavirus, on the other hand, primarily affects infants and young children, although adults can also be infected. Before the introduction of the rotavirus vaccine, this virus was the leading cause of severe diarrhea in children under 5 years old. This virus spreads through the fecal-oral route, meaning that it can be transmitted by ingesting tiny amounts of fecal matter from an infected person, often through contaminated hands, surfaces, or objects. Finally, we have adenovirus and astrovirus, which are less common causes of viral gastroenteritis but can still lead to significant illness, particularly in children. Symptoms of stomach flu. The symptoms of viral gastroenteritis typically begin suddenly, within 1 to 3 days after exposure to the virus. The hallmark symptoms are diarrhea and vomiting, which can lead to dehydration if not managed properly. The diarrhea is usually watery and does not contain blood or mucus, distinguishing it from bacterial infections like dysentery. Vomiting can be frequent and may lead to a feeling of exhaustion and dehydration. In addition to diarrhea and vomiting, individuals with viral gastroenteritis often experience abdominal cramps, which can range from mild discomfort to severe pain. These cramps are typically caused by the inflammation of the intestines and the increased movement of fluids through the gastrointestinal tract. Fever is also common, particularly in infections caused by rotavirus, and can range from low-grade to high fever. Headaches and muscle aches may accompany the fever, contributing to the overall feeling of illness and fatigue. Dehydration is a significant concern in viral gastroenteritis, especially in young children, older adults, and those with compromised immune systems. The loss of fluids and electrolytes through diarrhea and vomiting can lead to symptoms such as dry mouth, decreased urination, dizziness, and, in severe cases, confusion and loss of consciousness. Infants and young children may show signs of dehydration, such as sunken eyes, a sunken fontanelle, which is the soft spot on the head, and lack of tears when crying. Before we continue, if you have been finding the video helpful so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Diagnosis of stomach flu. Diagnosis of viral gastroenteritis is typically based on the clinical presentation of symptoms and a history of recent exposure to potential sources of infection. In most cases, laboratory tests are not necessary to confirm the diagnosis, especially in mild cases that resolve on their own. However, in severe cases or during outbreaks, stool samples may be tested to identify the specific virus responsible. Rapid diagnostic tests are available for some viruses, such as Rotavirus and Norovirus, which can help confirm the diagnosis quickly. In some cases, healthcare providers may recommend additional tests to rule out other causes of gastrointestinal symptoms, such as bacterial or parasitic infections. Blood tests may be conducted to assess the extent of dehydration and to check for electrolyte imbalances. Imaging studies, such as abdominal X-rays or ultrasound, are generally not necessary for diagnosing viral gastroenteritis, but may be used in certain situations to evaluate complications or to exclude other conditions. Treatment for stomach flu. The main goal of treatment is to prevent dehydration and to manage symptoms while the body clears the infection, as there is no specific antiviral medication that targets the viruses causing the condition. In most cases, viral gastroenteritis resolves on its own within a few days, and treatment can be managed at home. The first and most important step is to ensure the patient stays hydrated. This means encouraging them to drink plenty of fluids, such as water, broths, or electrolyte-rich sports drinks. Avoiding caffeinated or alcoholic beverages is crucial, as they can further contribute to dehydration. For those who are unable to keep fluids in their body due to persistent vomiting, oral rehydration solutions, like those used for treating diarrhea in children, may be recommended. These solutions contain a carefully balanced mix of water, electrolytes, and sugars to help replenish what the body has lost. In severe cases where the patient is showing signs of significant dehydration, such as excessive thirst, dizziness, or dark urine, intravenous fluids may be necessary. This is typically done in a hospital, where the patient's fluid and electrolyte levels can be closely monitored and adjusted as needed. As for managing the other symptoms, over-the-counter medications can provide some relief. Anti-nausea drugs, such as Pepto-Bismol or Zofran, can help control vomiting. For diarrhea, loperamide may be recommended, though it's important to use these medications with caution, as they can sometimes prolong the illness. It's crucial to note that antibiotics are not effective against viral gastroenteritis, as they are designed to target bacterial infections, not viruses. In fact, using antibiotics unnecessarily can do more harm than good, as they can disrupt the delicate balance of gut bacteria and potentially lead to further complications. One of the most important aspects of treating viral gastroenteritis is allowing the body to rest and recover. This means encouraging the patient to get plenty of rest, avoid strenuous activity, and sticking to a bland, easy-to-digest diet, such as the brat diet, which consists of bananas, rice, applesauce, and toast. This type of diet is usually recommended until the symptoms start to subside. In most cases, viral gastroenteritis is a self-limiting condition, meaning it will resolve on its own without the need for specific medical treatment. Prevention of stomach flu. In terms of prevention, the best defense against viral gastroenteritis is practicing good hygiene and sanitation. This includes thorough hand washing with soap and water, especially after using the restroom or before handling food. Avoiding close contact with individuals who are sick and practicing proper food handling and preparation can also go a long way in reducing the risk of infection. For certain high-risk groups, such as young children and the elderly, vaccines are available to provide some protection against specific viruses that cause gastroenteritis, like rotavirus. These vaccines can significantly reduce the severity and duration of illness, as well as the risk of complications. Now we want to hear from you. Do you or someone you know have stomach flu? What symptoms did you have? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.